Next, we're going to do 3 tests for thoracic outlet syndrome. All right? Thoracic outlet syndrome, the first test we're going to do is Adson's test. Adson's test is positive for an entrapment of the subclavian artery due to tight scalene muscles. All right? So to perform Adson's test, what we're going to do is we're going to first take the patient's pulse. Remember not to take the pulse with your thumb. The radial pulse, feel a nice, strong radial pulse in this position. Then you're going to put the patient in a position that will try to entrap the subclavian artery. So we're going to externally rotate the humerus and extend the arm. As we extend the arm and externally rotate, we're also going to have the patient look towards us. So Adson's look towards. Okay? In this position, a positive Adson's would be if the pulse is diminished as we have the patient look towards us and put her in this position of external rotation and extension of the arm. So pulse, diminished or no pulse as she looks towards would be a positive. The next test is Allen's test. Allen's test is again looking at occlusion of the subclavian artery, specifically because tight pectoralis minor muscles. Okay? So for Allen's test, again, the patient is seated. Okay? We're going to bring the patient up into 90 degrees of shoulder flexion, okay, and 90 degrees of elbow flexion. All right? And then, again, we're going to take the pulse. We'll take the pulse down here. We have a normal, strong pulse. We then bring them up in this position. Okay? This time, for Allen's test, we're going to have the patient look away. A positive Allen's test would be, in this position with the patient looking away, they would have a diminished or absent pulse as compared to when you bring them down in the starting position. And again, for all these tests, you're going to be comparing bilateral. So this is Allen's test. The last test we're going to do is Roos Test. And Roos Test is not specific for any type of neurological or vascular etiology. It's just a general thoracic outlet syndrome test. So this might be a good first test to do when you're doing testing for thoracic outlet, and then follow it up with an Allen's or Adson's to get more specific. So for Roos Test, it's a completely active test, which means the patient is going to do everything. So you're going to get the patient up into, with both arms up, into 90 degrees of elbow flexion, okay, and 90 degrees of shoulder flexion, okay? 90 degrees shoulder flexion, 90 degrees elbow flexion. With their palms facing forward, you're going to have them open their palms, and then you're going to have them open and close their palms at a normal pace for about 3 minutes. A positive Roos test would be, as the time goes on or at the conclusion of time, the patient reports the symptoms that they came in complaining of. Maybe some numbness or coolness in the hands, or an increase in radiating pain into the hands. Would be a positive Roos test. So Roos, again, thoracic outlet, not specific for any vascular or neurological etiology, but just general thoracic outlet syndrome.